this person got blood in their semen. Yeah, this person who participated in the HairDAO Jumpman human clinical trial that was largely underground got the side effect of getting blood in their semen because they were convinced enough by this charlatan Jumpman and also by proxy this ruse of a company, HairDAO, to take these very, very dangerous medications because it's a cult. Like there was a sort of cult-like worship of this Jumpman guy, and for whatever reason he was able to convince people on a mass scale that, hey, if you take these drugs and if you use them together, it will grow back your hair. And look, I'm sure people are trying to make money in this space, right? It's cool to be entrepreneurial. But when you're doing this largely at the expense of other people's health, especially when you're pushing chemotherapy drugs and powders with large impurities in them from a literal black market company. They're not gray market, they're black market. And then you go on forums to find desperate men who can't take finasteride or dutasteride, so you convince them that you have a solution. You're the scum of the earth, quite frankly.
That's the American way, isn't it, brother?
If I were to tell you that there was a hair loss cryptocurrency company that ran an underground and, quite frankly, illegal human clinical trial, where desperate men who were losing their hair were told to essentially buy largely unapproved and untested chemotherapy drugs to use on themselves in the hopes of growing hair, you would probably say, well, I'm crazy. And you know what? It does sound kind of crazy, because if that were to be the case, that would be pretty absurd. But unfortunately, this is true. And the company that I'm talking about today is called HairDAO. HairDAO. All one word. And instead of addressing any of the claims that I've made publicly, they decided to send me a cease and desist letter to my parents' house in the hopes of threatening me with a defamation lawsuit. Well, the absolute defense against defamation is the truth, and you're going to have to prove what I'm saying is false, because I have the receipts. So what happened, right? HairDAO, their lead researcher known as Jumpman, who largely still works for them today under various accounts, such as Papa Smurf and another account, I think it's called Shedding. This Jumpman guy put out a series of scientific articles and just random PDF documents where he came up with a protocol called the Jumpman Cure Protocol. And in this protocol, it consisted of around 26 drugs to be used simultaneously. Some of these drugs are literal chemotherapy drugs, right? It's not a joke. They're drugs meant for cancer patients. And some of those chemotherapy drugs haven't even been approved yet, even in some cases tested on animals yet. So this is a pretty big issue. Yet this Jumpman guy working on the behalf of HairDAO was able to tell all of these men how to use these drugs, the exact doses and frequencies in which they should be using these drugs, and these drugs aren't even publicly available. Again, some of these drugs do not even have an established safety dose yet because it hasn't been thoroughly tested, and that is pertaining to the chemotherapy drugs on this protocol. Yet HairDAO, being as eager and irresponsible as they were, and probably still are today, encouraged this behavior. They applauded Jumpman's activities. They applauded the fact that he went to various hair loss forums to spread the word about his underground human clinical trial. And in fact, in various occasions, HairDAO and Jumpman incentivized people to participate in this trial with a compensation package. That compensation package related to paying for the blood work of all clinical trial participants so long as that blood work was uploaded to their patient data platform. During this underground and illegal human clinical trial, and when I say illegal, I essentially mean they had no approval by the FDA to do this, some people got sick and hurt. HairDAO and Jumpman worked with a black market Chinese lab known as Jenny's Chems. And I'm not being hyperbolic, they're not gray market, they're not semi-gray or whatever, they are black market because they have produced illicit substances, as well as steroids. So HairDAO and Jumpman went ahead to build what is called a group buy, and this is when you get a bunch of people together to pool their funds to pay a distributor of some kind, and the distributor has a set minimum price that they have to reach in order to produce a particular good and then deliver it respectively to the contributors of the group buy. So many members of this group buy participated in this underground human experiment who were sold lies and dreams by Jumpman and HairDAO of getting a full head of hair based on faulty science. So what happened to the people that got sick, right? Well, somebody bought ketoconazole powder, and you might be saying, well, ketoconazole powder or ketoconazole, you can get that from your convenience store. It shouldn't be harmful, right? It's a staple product in many hair loss treatment protocols. But here is the issue. This ketoconazole powder was tainted with some kind of impurity that gave people a rash. Okay, maybe that isn't too bad. But the fact is, somebody did get sick from this, right? By getting a rash and getting inflamed skin, they got hurt. And then, more horrifically than the last, after using a compound called TM5614, by the way, this compound was something that HairDAO and Jumpman were very, very keen on getting these human subjects' blood work data for. Somebody who ingested this TM5614, it's a PI inhibitor, but it's also being used potentially to treat types of leukemia. This person got blood in their semen. Yeah, this person who participated in the HairDAO Jumpman human clinical trial that was largely underground got the side effect of getting blood in their semen because they were convinced enough by this charlatan Jumpman and also by proxy this ruse of a company, HairDAO, to take these very, very dangerous medications because it's a cult. Like there was a sort of cult-like worship of this Jumpman guy, and for whatever reason he was able to convince people on a mass scale that, hey, if you take these drugs and if you use them together, it will grow back your hair. And look, I'm sure people are trying to make money in this space, right? It's cool to be entrepreneurial. But when you're doing this largely at the expense of other people's health, especially when you're pushing chemotherapy drugs and powders with large impurities in them from a literal black market company. They're not gray market, they're black market. And then you go on forums to find desperate men who can't take finasteride or dutasteride, so you convince them that you have a solution. You're the scum of the earth, quite frankly. So you don't have to listen to what I'm saying, right? You can just simply look at what they're doing. You can look at their model as a business. I want to ask the audience this. Do you think it's normal for a quote-unquote biotech startup or a pharma company to have their clinical trial participants pay to be in a clinical trial? Does that make sense to you? If you're paying to be a part of a clinical trial, and you really have to take into account ethics here. I know, it's woke to think about ethics, right? But think about this. If you pay to be in a clinical trial, you're thinking on some sort of implicit level that you paying is going to cure you. It's going to help you. When that's not the case at all, right? You shouldn't be paying to be in a clinical trial. The company that you're going to be a clinical trial subject for should be compensating you. They should be giving you free healthcare, or healthcare on their expense is what I mean. Or they should be, giving you other incentives. They should be flying you out places. They should be taking care of you for as long as the clinical trial goes on. Maybe they have a post-trial benefit where they actually, maybe the treatment goes to the market and they actually give you a reduced expense in getting that treatment, right? There should be a compensation from the biotech company or pharmaceutical company given to their subjects, human subjects, because quite frankly, you're doing them a favor, not the other way around. So that's a bit of a summary of the things that I've been dealing with from this particular company. And again, I have all the evidence I need to back up every single claim that I've made in case these bastards want to take me to court. But it looks like they're reincorporating their company in the state of Wyoming here in the United States. And for those of you who aren't in the US, every state has their own law or has vastly different amounts of laws. So these guys used to be based in the state of New York, at least for their lab, but they were registered in the state of Delaware. And these sort of, northeast kind of states here in the United States are very liberal in their policies, and they provide for protections against people like journalists or people who report on things to not face what is called a SLAPP lawsuit. And SLAPP, S-L-A-P-P, stands for Strategic Lawsuit Against Public Participation. And this is typically when a company tries to take someone to court, a smaller guy to court, and they try to bury them in legal fees, even though this company may very well be wrong in what they're doing, in the sense that there is no defamation or there is no crime that they've actually faced. they're betting on attempting to drag the opposing party and hope they don't have the sufficient funds to fight back, such that they would have to capitulate to the company or the larger party and essentially lose that case. Now, this is very bad. It goes against our civil liberties here in the United States, the First Amendment, freedom of speech. But many states seem to have a variation of laws called anti-SLAPP laws that prevent this from happening. But like I said, it seems as if they're trying to reincorporate their company in the state of Wyoming because, well, Wyoming doesn't seem to have these protections, but I don't think they understand a thing called jurisdiction. That state, Wyoming, has no jurisdiction on me, so again, HairDAO can go fuck themselves. But anyway, let's react to some of these crazy claims made by these very, very weird guys.
What's really cool is that the people who work with us are willing to work for air tokens, which I don't think is true for a lot of crypto projects. Like to say is like, are you a product of the soul? They can even people care. Which changes a lot off because we've essentially, we spent very little money and we had a community growth. Slowly you can learn our on my tech token. The name Capital Operation is exactly one that I'm not going to get to the heart. Capital Operation is basically everything to do just like hyper-efficient. So like the big innovation I'm sure most of you are familiar with cryptos that I can send you, I believe that as I can send you a text message, something like the hair token is like our equity. We can issue you $15 worth of hair for doing a small task force, whereas if we were the Cayman Island or British Virgin Island, it would cost like $500 the same transaction.
Okay, so when watching this video, it kind of reminds me of like a high school presentation. So you have these two dudes just standing in front of a slideshow. It looks very weird in this like rinky-dink kind of science room. You know, whatever. Maybe they're presenting to a bunch of high schoolers. But in any case, when you listen to their business model, what did they just say? We give people hair tokens if they do things for us, if they work for us. And hair tokens are kind of like their company's form of equity. So this is very important to establish because it makes a lot of people who are in their Discord server, who work for their DAO, who do things to contribute to this company becoming successful. These people are essentially employees.
On the clinical trial side, like our managers would pay the clinical trials. The way the virtual type works is usually big pharma pays a clinical trial placement person to like very much back again basis and they try to find one. We'll literally just have like a full story.
So here's where this idiot, the guy wearing the white shirt, Andrew Baxt, just fucking messed up. You're calling these people patients? You know, patients are, that's a very particular word. Are they your patient? And if they're your patient, you have to ask the question, who's the doctor? Who's the person that's overseeing a bunch of desperate, balding dudes buying chemicals, some of which are literal chemotherapy drugs from a literal black market lab based in China? Would it be the esteemed professor of dermatology, Dr. Ralph Paus of Miami University? Or would it be Dr. Claire Higgins of the Imperial College of London? Are these your professionals or doctors who are overseeing these men use these drugs on themselves? And considering that Dr. Claire Higgins, according to the HairDAO Twitter, was noted to have worked with Jumpman, I wonder, did she see Jumpman's cure protocol where he told people to use these chemotherapy drugs on themselves and how it was going to grow hair? All these questions, of course, we know the answer to. These people were not patients. You were trying to call them patients to make your project actually look more legitimate than it actually is. It's bullshit. And I mean, you clearly acknowledge the fact that these people are doing this and you pay them with hair tokens. Like, you are paying people to use these things on themselves. And then report the patient biometric data back to you so your company, HairDAO, can perform bioinformatic assessments so you can find fancy gene targets. And guys, it sounds more flashy than it actually is. It really isn't all that impressive, to be honest with you. Again, the co-founders were stupid enough to listen to a guy named Jumpman who made a random protocol of chemotherapy drugs that he said was going to grow hair. Just think for a second, right? When you take chemotherapy drugs, the purpose of chemotherapy is to slow down fast-growing cells in your body. And cancer cells, right, they duplicate very fast. They are fast-growing cells. And another group of cells that grow very fast and duplicate very fast are your hair follicles. Now, guys, if you're going to use a drug that is designed to suppress that sort of fast cell duplication, right, why would you put that on your hair if you're concerned with growing hair? It makes no sense. This guy was, brilliant in the sense that he was able to fool these idiots, these co-founders, Andrew Verbinen, the guy in the, I guess, maroon sweater, and Andrew Bax, the guy in the white button-up. He was able to fool these idiots into actually believing in his quote-unquote research, and then a whole cult worship formed around this Jumpman guy, and it's going to lead this company into some major trouble. So instead of taking me to court, you guys should probably think about how you're going to address my claims outside of court and just, address them. Like, is what I'm saying false? Am I wrong? Am I lying here? You can just say that I'm lying, but you can show evidence of me lying about this. But I don't think you guys have that because what I'm saying is true.
There's kind of like three types of members, if you will. They're like super passive ones, so like people who are like buying those drugs on those DTC companies but they don't do research. They're like people who are kind of like in the channel and chime in, but they don't kind of go the whole 10 yards. And then there are people who are like I was saying, like literally try drugs on themselves. So this chronicle, what it will be is a patient database. We'll call it the patient portal, where you'll upload your hair loss treatment data, your genome, and then photos of your head, and you'll receive characteristics for doing so. Like we equipped all, well, Michael and all the equipment, so if anything goes wrong, maybe essentially what that will do is we can then run patient outline data and find gene targets or other sorts of things, professional gene targets, for us to run trials. So that's an example of where getting those early, like even the passive patients can attract a lot more of the more early stage researchers.
So that's what they're doing. So they're trying to get very, very cheap patient data. So here's the thing, right? Let's get Jumpman to go on a bunch of weird forums on the internet where we can find some desperate, balding men, maybe on the post-finasteride syndrome forums, maybe on some very niche forums where people are trying to look for treatments that can actually help them, right? Let's kind of exploit them and manipulate them into joining our clinical trial. Let's present them with very quote-unquote believable science when in reality we know this couldn't really work because we're using 26 chemicals at the same time. So there's so many variables that even if something were to work, it would be hard to figure out what actually is producing those clinical, benefits, right? Those clinically significant benefits where you're seeing hairs starting to grow out of the scalp, which, by the way, hasn't even happened. All that is just maybe a cheap excuse, in my opinion, I can say. All that is a cheap excuse of just getting people's biometric data so you can sell it, maybe run a gene analysis on it of some kind. That's what they talk about. It doesn't really seem to be helping anything.
I also just think a really cool part of this product is that there is a lot of biohacking going on with people getting hair loss. Unfortunately, so all that data really just gets lost through various Discord chats and stuff. And so this tool will sort of allow people who are maybe finding something on the run to upload their data, upload their results. And then if we actually want to take it to a more formal trial, where our odds of success are just greatly improved by sort of the observational study data that we're going to be able to with this tool.
Oh, okay. So when Jumpman ran his underground illegal human clinical trial, where he convinced a bunch of balding, desperate men and manipulated them with fake studies, these studies were very bad in terms of their science. So he told these guys to use these chemicals on themselves, some of which being chemotherapy drugs. All of that was a way to cut your expenses so you didn't have to run a formal human clinical trial, right? And that's probably why Andrew Bax said in this Discord message over here, Jumpman saved us millions of dollars and cut it down to tens of thousands of dollars. Like Andrew Verbinen said at the end, it's important for them to acquire this data. So they throw a bunch of crazy-ass drugs that haven't been tested yet to people who are desperate, taking advantage of their situation, so they can have a cheaper in vivo, meaning inhuman, model, which would apparently help them run more efficient human clinical trials in an official manner. And the craziest part about this situation is that I don't even think these guys are competent enough to run an FDA clinical trial by any means. I mean, look at the co-founders, right? Specifically Andrew Bax, because he's the one that made the biggest fuck up in all of this. This idiot doesn't even know how to set up his financial statements for his quote-unquote cryptocurrency venture capital firm called Byzantine Capital. There are a lot of inconsistencies with it that kind of points to it being, in my opinion, my First Amendment opinion, it being a scam. So, all that being said, I'm sorry for the drama that's been occurring on this channel. I have to address this publicly, because these assholes are trying to take me to court on false things. And I'm going to speak my mind. I'm going to state things how I see it, and, well, things that I see that are true, because I have the evidence for it, and I've experienced it, right? So guys, if you come across HairDAO, and if they try to convince you to use their products, they're probably grifting you. I would stay clear from them. I don't even think they're, a real company in the sense that they're actually going to find the cure to hair loss. Let's keep this into perspective. There are biotech companies, pharma companies that are subsidiaries of big pharma companies that are trying to research hair loss, right? Especially androgenetic alopecia. There's a lot of money in the market for it. You really mean to tell me a couple skibbities on Discord can come together and make a cure? No, that's not going to happen. Maybe they can, clip this however they want to. But as they are now, that's not going to happen. At the present moment, they're trying to float around this topical thyroid treatment where they say, it's going to grow back your hair. Okay, guys, if you use, topical thyroid medication, even if it's at a low dose like they are, proposing, if you use that long term for a chronic condition like androgenetic alopecia, what do you think's going to happen? Some of these thyroid hormone medications have a half-life of around 1 day, maybe a bit shorter than that. So if you're using it consistently every day, and if it's going systemically to an extent, over time, you can really mess up with your thyroid. A researcher that they're even affiliated with, Dr. Ralph Paus from the University of Miami, even stated in one of his papers that topical thyroid shouldn't be used long-term and should only be used in the short term to potentially, they don't even have the full evidence for this, but potentially treat telogen effluvium. Again, they don't even have the full evidence of that even being the case. So, my final verdict, steer clear of these fucking dickheads. This is not a legitimate company in my opinion, and if my word means anything, hopefully you guys can consider it and, take it to heart. Anyway, that's it for this video, and in the coming weeks, I'm going to be releasing the HairDAO documentary in parts, because when I initially released it, it was all together, but I think I'm just going to distribute and release it in parts, so when all the parts are out, hopefully we can leave these horrible grifters in the past. Anyway, thanks for watching, guys, and I hope to see you in the next video with some new content. See you later.